These are a couple of exercises you can do if you're having carpal tunnel syndrome. For this syndrome, you might be having neurological deficits into your first 3.5 digits in your hand. You also might be lacking a bit of grip strength. So these are some exercises we'll go through. There'll be mobility, some strengthening and some stretching, and also a nerve floss as well, which you can do. For mobility, to warm up and general increased range of motion within our wrists, what we want to do is be increasing our movement through all ranges. You might find it a little easier to have your wrist over the edge if needs be, just to prevent external and internal rotation of your shoulder when doing this movement. So come on to a surface where your wrist's over the edge, and we're just going to be moving in and out, so ulnar and radial deviation of our wrists, and also down and up. We can do this on both hands. Sitting down, you don't need a surface, and we want to be aiming for around 20 for each direction, side to side, down and up. And then we can also do some circular motion forwards and backwards. Like I said, do around 20 for 2 to 3 sets every day. So that's just general mobilisation of our wrists. In terms of exercising and strengthening for our wrists, we can use a grip strength. So you can use a ball, a toy, anything that's soft cushioning to be able to increase a bit of the strength within our grasping motion of our hands. So with a soft ball, we want to just be increasing a bit of our grip strength for our hand. I've got a ball here, like I said, you can use a toy, anything soft which you're able to get a good grip on. We're going to be aiming for around 8 to 10 reps of this for 2 to 3 sets every other day. If there's any pain at all, don't push through. Remember to breathe constantly throughout. We can also increase the movement of our wrists through our flexors by doing slow reps. I'm using a light weight of 1 kilogram. We want to start off slow and gradually increase as our strength increases. So just flexing our wrist up with a light weight, same again, 8 to 10 reps for 2 sets every other day. We can also do radial deviation, so strengthening up the muscles to radially deviate our wrist, up and down, 8 to 10 reps again, 2 sets every other day. And finally, our extensors of our wrist, all the way up and slowly back down, and up and back down. A good technique which you can do to help relieve some symptoms which you're experiencing in your hand is called nerve flossing, and this is essentially moving the nerve through its sheath. We don't want to be stretching the nerve or causing it to be too loose, it's gliding through. For this exercise, we want to put our palm up towards the sky, and we're going to bend our wrist down and lean our ear towards that shoulder, and then back down to the opposite side. And if you imagine, we're gliding all the way across and then back up. For this, aim for around 5, 10, 15 reps for 2 sets every other day as well. Those are all our mobilising, strengthening and gliding exercises. For our stretching, we can come to a surface. You can also do on a wall, but preferably on a flat surface. It could be a countertop. We want to turn our hands away from us, so all the way away, and make sure our palms are fully on the surface as well as our thumbs and fingers. And we're just going to lean slowly backwards, and you should be getting a stretch all the way up your flexors for your wrist. We can also do the opposite direction, so push our hands facing with our fingers towards us, make sure our fingers as well are on the surface, and just lean in backwards for a nice stretch all along the extensors of our arm. Hold these stretches for around 15 to 20 seconds for 2 to 3 sets. Try and do these every day as well. So these exercises are general guidelines for guidances for if you have carpal tunnel syndrome. If you have any concerns, worries, or any pain, obviously don't push through the pain and speak to your healthcare provider if you have any concerns.